Hello, good afternoon, Dr. Chidi Ufondu, and welcome to this weekend's episode of Open Clinic with Dr. Chidi. And today we're going to talk about coping mechanisms. How do we cope with infertility? When infertility strikes a family, how can we cope while we are still doing our best to get good outcome? So that will be the topic for this afternoon. My name is Dr. Chidi Ufondu. I'm the convener of this group, and we meet every Saturday about this time. I apologize, I came a little bit late. So today we're going to talk about coping mechanisms. We're going to look at 5 ways you can cope with infertility. You see, infertility is a very big bully. The aim of infertility is to take your joy away, is to take the love you have between each other away, is to take the ambience, the goodness. You know, when you come together with your partner and you want to start your family, you've already envisaged the number of kids you want to have. Some want to have 6 girls, 6 boys, 2 girls, 2 boys. So we've already envisaged how our family will look like. Now, when you begin to get to about 6 months after regular lovemaking and the babies are not forthcoming, if you pay attention, you will notice that infertility can cause a lot of stress in your relationship, which, if it's not properly handled, it can actually lead to a lot of mental health challenges, which can go through depression, anxiety, bipolar, and even some women might be suicidal. So today we're going to look at 5 tips of coping. Coping is very important. Now, in as much as we might not be able to control the physical aspect of infertility, so the only thing we can do is to do our best, but you can control your coping mechanisms. And this is what I want us to talk about today. There are a couple of red flags you have to be conversant with. Now, we also need to understand a couple of facts. Infertility is a monster. So what do I mean by infertility being a monster? The aim of infertility is to beat you up. Once you wake up in the morning and you buy into that negative vibe, your whole day is going to be ruined. You begin to question yourself. You begin to question your sanity. You begin to question your beauty. You begin to question your confidence. So here's the deal. In as much as we cannot control the physical and the health aspect of infertility, we can control our thoughts. We can control how we manage the stress. Infertility can cause severe health challenges, severe mental health challenges, including death. We've had situations where women became suicidal because they felt they failed the society, they felt they failed their partner, they felt they failed themselves. So in order to stand firm and fight infertility, you must understand the nature of the beast. Once you understand the nature of the beast, we can begin to control our thoughts. If we can control our thoughts, we can control everything. Everything happens in the mind. So I want to encourage everybody currently attending this clinic today, just let go. I want everybody to actually take a deep breath. Can we all sip in some fresh air and exhale? Just do this exercise with me. It's really helpful. Sip in some very strong air. Let me follow you guys and do that. Then let go. Okay? So basically, what you think over time will shape what you feel. If you combine what you think with what you feel, it's gonna control your thoughts. And your thoughts are gonna shape everything you do every day. So I want us to strike a balance. In as much as I want you to be worried, but be worried for the right reasons. But I want you to strike a balance between work and play. Now, today is weekend, right? You should also look for some couple of coping mechanisms. I don't want you to just wake up and you stay in one place, you're feeling down, you're depressed and all that. So let's look at the 5 points. Number 1, I want us to individually take stock of our mental health. You see, anybody can be a victim of mental health. You know, when you see people that are kind of losing it when it comes to their mental health status, they are not going crazy. They are just going through life challenges. So anybody can develop depression. Anybody can develop anxiety. Anybody can develop bipolar condition. Even people you think that the world is enough for them. So I want everybody going through infertility to take mental health state check. Check your mental health state by yourself. There are a couple of things I want you to practice. I want you to focus on 3 Ds. These 3Ds will help you to know where you stand. The first D is disorganization. You know you're pretty much a very organized person. Now, when we compare men and women, women tend to be more organized. Now, you as a woman, when you notice you are just completely disorganized, you don't know where you drop your keys, you have your pen in your hands, you're suddenly looking for it. If you notice lately, you've gone through a lot of disorganization, you need to take a step back and you need to think about that. Now, number 2D is decision making. Now, decision making, the micro decisions we make every day will shape what we do every day. So, if you can't decide what you're going to eat in the morning, what you're going to wear before tomorrow, little things you do every day, it's possible you're going through mental health exhaustion. It's possible your mental health needs to be on check. Now, dependency. If previously you used to do your thing, you don't bother anybody. Matter of fact, there are some people that don't like anybody doing anything for them. I fall into that category. I want to do my own thing my way. If I fail, I fail. I pick myself up and I keep going. But if you noticed, lately you are so dependent on your spouse, you're so dependent on your friends, you're so dependent on your mom. Little things you can fix, you begin to depend on them. It might be a sign you are going through severe mental health meltdown. So remember, disorganization. If you notice some level of disorganization in your life right now, please step back and go seek help. If you notice you can't make decisions by yourself, especially decisions that will affect you in your work, in your home, in your car, in your shopping, things you normally will do every day. If you make the bad decision in your work, it's going to affect your career. And you need your career to keep on getting money to go for infertility management. So focus on the 3Ds. The 3Ds will help you to know where you stand in your mental health status. Very important. Now, number 2, everything I'm teaching you is practicable. Number 2, I want you to focus on the now. You can't change the past. Stop reliving in the past. Stop basking in should have, could have. It's gone, it's gone. If you made mistake in the past, if you had abortion in the past, if you made the right choice of spouse, if you did whatever you did in the past, if you didn't take your prenatal multivitamins, if you didn't go for your IVF, if you didn't go for your IUI, it's gone, it's in the past. Stop living in the past. Live in the moment. Now, stop going into the future. You can't control the future either. So stop reliving worries. So stop thinking, oh, what if this IVF fails? Oh, what if I'm not going to become pregnant in August? Now think about what if you can. So stop thinking about failure. Think about positive. So stay in the now. Focusing in the now will give you the energy you need to keep going. So number 2 way is to focus in the present. When you wake up in the morning, you thank God, you say, God, I thank you, I give all the glory. Today is my day. I'm going to become pregnant. I'm going to make love. I'm going to exercise. Then stay in that mode because you can actually control the present. Once you can control the present becomes the past. But focus on the future, but live in the now. Now, number 3 point, practice self-care. There are so many couples going through infertility, they have completely abandoned themselves. You look so disheveled, you look so unkempt, you don't look after yourself, you don't sleep, you just don't care no more. If you can treat yourself just half of how you treat your families, of how you treat your mom, your dad, your friends, your siblings, take a moment and give yourself self-treat. So personal self-care is also part of coping mechanisms. So get enough sleep, go and exercise, spend time alone, take yourself out, go to a good restaurant, go to a good boutique, shop for yourself, buy things that make you happy. If you practice this, trust me, if you make yourself your best friend, you will see yourself overcoming. Practice self-care. Self-care is very important. Don't bother about what people will say. So many people won't even bother that you're having infertility. They just need your money. They need your attention. So there are so many of us that are very good. Whenever people have problems, that's the only time we see their call. That's the only time we see their text messages. When your mom is having problems, when your dad is having problems, when your siblings are having problems, that's when they remember you. But you don't remember yourself. So stay in the lane. If people are calling you selfish, that's okay. Give yourself self-treat. Think about you. Prioritize you. Give yourself good treat. Take yourself to the spa. Go for manicure. Go for pedicure. Shop. Eat. Feel good. Go to movies. Go to the beaches. Spend alone time. Do this for yourself regularly. Now, number 4, you have to talk to yourself. You see, when I tell you stuff, you might consider that. But when you give yourself daily pep talk, it's powerful. When you're taking your bath and you look yourself up in the mirror and you begin to speak positive and you begin to remember the daughter of who you are, when you talk to yourself, it tends to stick. So learn how to talk to yourself. You can make it audible. Nobody will think you're going crazy. So look yourself up in the mirror and begin to tell yourself, I'm a mother of 4. I'm a mother of 5. I'm a mother of twins. I'm a mother of triplets. I'm a mother of quadruplets. When you begin to speak to yourself, it's very, very powerful. Others can remind you, but when you remind yourself, it has a very huge impact. Go and try this. You will thank me later. Now, when you're done talking to yourself, I know for some people, it's very difficult to open up because of the society, because of being judged, because of being blamed. So some people don't learn how to talk to people. Now, personally, I know there are so many reasons why you will be reluctant to discuss your infertility with your friends, with your family, or in your workplace. I understand that. And guess what? I agree with you. You might not want to keep your medical issues open. You might want to keep it, within you, because some people can give you unsolicited advice. Some people can begin to make up story, even in your dating game. So you might want to be private. But guess what? When you go out there are some select professionals you can talk to. You can at least talk to your doctor because you need to talk to somebody. If you begin to go through the journey of infertility alone, it can sink you. It's a sinking sand. So you need to look for someone to talk to, a professional. When you manage your emotions alone, you can be overwhelmed. So talk to someone that understands. Now, the other point, focus on work. You see, if you are gainfully employed, employment can be your own self. You can work for yourself. You can have your business, or if you can have work. When you're going through infertility, if you have an organized work, things you do from waking up till daybreak, it will keep you busy. So as stressful and preoccupational that infertility journey can be, when you stay busy with your work, it provides you effective distraction, which you need. So focus on your work while you're going for all your appointments, while you're praying, while you're making love, while you're seeing a fertility specialist. Your work will provide you a good source of distraction. Your work will take away the persistent anxiety from failure, from negative pregnancy test. Stay busy and active. When you stay busy and active with your projects, with your conferences and all that, you'll have a sense of accomplishment. When you have a sense of accomplishment, you tend to have a sense of belonging, a sense of self-worth, a sense of personal love. So go and focus more on your work. Don't spend the little time you have trying to beat yourself up, trying to regret what you did and what you didn't do. It doesn't matter. Now, the next point, try cognitive restructuring. Cognition means thinking. If you can restructure your thinking, together, when you think about what you will say, when you think about how you will respond, you are taking charge. Let me give you an example. If you focus on hopeless stuff, you will not even convince yourself you will be a mother in 2023, right? But when you restructure your thinking, when you begin to think about your babies, when you begin to call their names, when you begin to shop for them, when you begin to envisage their room, you are empowering your cognitive thinking. And somehow, over time, we become what we think. So restructure your cognitive thinking. Be in charge. Now, lastly, check for depression. Check for depression. If you notice you no longer take interest in things that used to make you happy, if you notice you are easily, any little thing can make you to cry, to feel sad, to feel tired. You don't sleep enough. You no longer eat. You're very, very sad. Even things that make you happy, even you and your partner, you guys do no longer communicate. It's possible you might have depression. Depression can be mild. If you have mild depression, you will notice you're easily tired. No matter how much sleep you get, you notice you're tired, you're sad. If you wake up in the morning and you're already sad, think about that. You might have depression. Now, some people can have severe depression, which can lead to frequent crying. Every slightest moment, you are crying. You're losing appetite. You feel despair. You feel the world is coming to an end. Please seek for help. all the signs of depression should be taken serious. Don't tell me I'm going to pray, I'm going to see my pastor. Your pastor is a spiritual role player. But when you have a medical problem, ring your doctor. If you have depression, we can manage it medically. So whether depression is triggered by hormonal therapy, recurrent pregnancy loss, treatment failure, financial or relationship stress, there is help. You can get help. Speak with your doctor. If you can all do all these steps, the 5 things I mentioned, I can guarantee you this. In 2023, you're going to dance. Okay, so that's my presentation very quickly. I'm going to open the clinic. We have a full house. Dr. Ndiche, thank you for coming. Kenneth, thank you for coming. Chinyere, Onyinye, and our amazing Tosin. Let me tell you guys about this lady. She's a mother of 2 babies, amazing babies. Now, she wants to have another baby in 2024. This lady has never missed any of our clinic. This is the signature member of this community because she has gained so much. She, matter of fact, doesn't even need us. That's a fact. But she shows up. She's contributing to the community. She's helping other women. She's donating stars. Tosin, God will bless you. Keep being you. I want everybody in this community to emulate Tosin. But right now, guys, the clinic is open. Remember, immediately after this clinic, I'm going to run another clinic in our Facebook page. So if you missed this, probably because you didn't start with me, don't worry, quickly gravitate to our Facebook page. Immediately, I'm going to repeat exactly this clinic. But the clinic is open now, so please feel free to ask all your questions. Please, these 5 steps, walk. Think about your mental health. Focus in the now. Focus on you. Talk to yourself. Talk to a professional. Focus on your work. Restructure your thinking. It works. Nobody can help you in this world. If you throw a pity party, there are people are going to throw a pity party. Let me tell you the truth. Do you know sometimes your husband, your mom, your dad, your siblings, do you know they might be part of the problems you're having? Because we are in a judgmental world. We are in a comparative world. So your mom, anytime you call your mom will keep comparing you with your sisters, with your cousins, and you know you don't feel good about this. But you want to be a good girl. You don't confront your mom because you want to respect your mom. But you know that this talk, this particular way your mom is treating you is causing you a lot of stress. You know your husband is berating, your husband is blaming you. Meanwhile, he's not gone for his own seminal fluid analysis. So sometimes our families might be our problem. Learn how to step out of the bubble and protect your sanity. Nobody can protect your sanity, okay? Please start asking your questions. What can make a woman's egg not to develop for fertilization? Couple of things. Number 1 point is your age. As you are aging, you have predominantly abnormal eggs. At any point in time, a woman will have a ratio of normal and abnormal eggs. So once you came into this world, you have millions of eggs, right? So out of those millions, you have more normal eggs compared to abnormal one. But as you're getting older, every month you're losing eggs and you're losing a couple of eggs. By the time you get to 25, you notice appreciably drop in the quantity of eggs you have remaining. Now, by the time you're getting to 35, you notice a sharp drop. So number 1 factor we have to consider is what? Age. Now, some women can also have congenital problems, which means, they might have some structural problems in their reproductive system, which might have affected the way the eggs are produced. Now, any other thing that affects the whole reproductive pathway can affect your ability to release your eggs. Now, there are so many gynecological problems that women might have. Some women might have polycystic ovarian syndrome. Some women might have hormone imbalance. So any of those things can affect the ability of your eggs to be normal. Unfortunately, there is no drug that will give you quality eggs. What we normally do for women is to use the time we have and use the eggs you have, because once you lose your eggs, you can't replace them. As compared to men, men produce sperm every 3 months. Women, once you've lost your eggs, you can't replace them. And it's a factor of your age. The biggest factor that will help a woman to become pregnant is her age. Okay? So if you're below 35, you have a lot of time. All right, guys, please keep asking your questions. Okay, COO, what's the best way to support friends, family struggling with their fertility? By listening. We have to listen. We have to support them. Now, this is my practical step towards supporting people having infertility. Think about how they are thinking. Follow their trend of thought. Let me give you an example. If you have a sister, big, young sister, it doesn't matter, and you know she's been having infertility for a long time, find a convenient time. When you call her, find out her state of mind. Introduce certain things that might not be related to infertility, then try and sample how she feels at that particular conversation. Then subtly find how she feels and what she needs to talk about. If she opens up, then advise her properly. I don't want you to be judgmental. I don't want you to be quoting Bible verses up and down. People go through stuff differently. People handle infertility differently. So I don't want you to be judgmental. I don't want you to be comparing. I don't want you to be telling her this and that. And also don't give her false hope. So if you find that communication very user-friendly, then subtly introduce help. Advise her to join a support group. You can refer her. You can ask her one or few questions. You can ask her how she's doing about it. You can even educate her. You can tell her about PPP. But please don't go there and begin to apportion blame and begin to talk the things you know and the ones you don't know. Follow their thought process. When you communicate with them, find out what they want to talk about. There are certain things you cannot text. Text message is one of the biggest killers of relationship. There are certain things you will send to your sister, to your brother, to your friend concerning infertility. They will read it differently. Remember, they're already very sensitive. So sometimes people that care for you can tell you stuff and they can be misinterpreted. I've had a couple of my clients who I truly, genuinely wanted to help. When I tell them the reality, some of them flip. As recently as 2 weeks ago, we were celebrating, my wife's birthday, and someone sent me a stinker. I felt really, really bad because since 2018, this is someone I've always wanted to help because I do that her reality. So people are very sensitive. You are better served not introducing that topic than to want to help, but the people you're helping are seeing it differently. So women going through infertility are very sensitive. So it's a very, very sensitive topic. If you feel that person needs to talk and they open up, then you can quietly come in and you can begin to give them good advice. Admin, very solid question. I love that. Can ovarian cyst prevent one from conceiving? So what we know, majority of the cysts you will have as a woman will be what we call functional cyst. Functional cyst is part of your menstrual cycle. So directly, it will not affect your ability to become pregnant. However, there are some forms of cyst that might delay your ability to become pregnant. An example is endometrioma. So if you have anything that affects the whole function of your ovaries by taking a chunk of space or by damaging your ovaries, like endometrioma, what's endometrioma? You have endometrial cells in the ovaries taking up shape, destroying your ovaries. So that type of cyst can cause infertility. But functional cyst doesn't have anything to do with your fertility. Is it possible to come to terms with and live a fulfilled life without children? How does one begin? Yes, it's possible. You have to graduate to a particular stage in life where nothing else can touch you. You see, life is good so long as you're living, thank God. You see, the reason why some people kill themselves looking for babies is because they want the society to validate them. So there are some women, if they come to a particular age, if they haven't found husband, even when they find husband, if the husband is not rich, the society will blame you. Your mother will blame you. If you marry a good husband, rich and all that, you give the husband a baby girl, they will blame you. They want baby boys. So you can't please the world. So if you know you've done your best, and you also have a good partner, because it takes two to tango, right? Now, if your partner is at the same frequency with you and you guys jointly decided that we are no longer gonna expose this woman to all these infertility drug injections, failures, and all that, because for any negative pregnancy you get, something dies inside of you. For any failed IVF, something dies inside of you. For all those injections you're taking, it's changing a lot of things in you. So there are some caring men. I remember a member of this group, a very solid guy. He told me, Doc, you know what? I'm not going to subject my wife to another failed IVF. We're going to go for surrogacy. I love that. So you will come to a particular point in your life. You will say, I've done my best. And if my best is not good enough, let God do the rest. Admin, capture that for me. So long as you've done your best, your very best, let God do the rest. So yes, admin, there's a stage you will come to in life You will come to reality. You will come to terms by defining what you have. Unfortunately, we are from a society where our parents most times will impose what they want. Most parents want grandkids. There are actually some couples that they will still tell themselves, you know what? I just want to go and adopt a dog. I just want to adopt a pet or a cat. I don't want kids. There are some couples like that. There are some couples that enjoy each other, live up to the 70s, but they don't have their own kids. They can go about adopting kids or giving money to other homeless babies, places. So it depends on what you want in life. But it takes a lot of maturity to get to that point because most people want the society to approve them. Matter of fact, it will surprise you that in some locations in Africa, when you die, a woman that married without kids, they won't bury you properly. Do you know that? So people and the society can be so mean to you that you want to do everything possible to conform to their standards. But if you come to that maturity stage where you can do your own thing and you say, you know what, this is me. This is what I want. I want girls. I want boys. Babies or no babies, I'm good. Because some women will have 5 boys. Some women will have 5 girls. But because their partner or their husband is whatever wire, they will begin to look for another avenue to have a particular gender. And some of them can kill themselves. So you have to come to that maturity point where you say, you know what, I'm done with this. I'm going to do me. So yes, it's possible to get to that stage. But you have to carry your partner along. In a situation where one is going through depression but doesn't have the resources to seek professional help, what self-help can this person engage? You see all the points I listed? That person can start from that. Sleep, eat, exercise, very important. But here's the deal. It takes a doctor to diagnose depression clinically. You see, you might be going through stress now, and any start testing, you tell me I'm depressed. There are so many women that any start testing, doc, I'm depressed. You don't have depression until we've diagnosed depression by checking a couple of clinical criteria. Now, unfortunately, if you have clinical diagnosis of depression, you need to seek professional help. But there are certain things you can do by yourself. And depression is seen differently depending on where you're coming from. From Africa, most of us don't believe in depression. Most of us think it's spiritual thing. They take you to church. Some of them will even use cane to flog you, to flog away the evil spirit in you. Depression is not a spiritual problem. Anybody can be depressed. So unfortunately, there are a couple of things you can do by the 5 points I gave regarding, coping mechanisms. But at the end of the day, you need to seek professional help. You need to at least talk to someone higher than you in a professional hierarchy, like you can talk to us. So I might not be a specific mental health professional, but I can give you a couple of tips. So you at least need to talk to a health worker at some point, okay? Now, you have fibroids. You are placed on contraceptives. You've been bleeding for 2 weeks. Now, you are not supposed to bleed for 2 weeks. If you have fibroids, now, my sister, the question is, if you have a diagnosed fibroid, and probably you want to have a baby now the question is, why are they giving you contraceptives? What for? Think about removing it. I don't know your full medical history, but the problem is this. We've noticed that some women will have fibroid. They don't want to remove it, and they still want to have babies. And that fibroid will keep growing big. Now, one of the presentations of big fibroid is excessive bleeding, bleeding in clot, and painful bleeding. So you need to review your journey. You cannot be bleeding for 2 weeks. You see, you can easily go into an anemic situation without knowing. Women ordinarily lose a lot of blood. So if you've been bleeding for 2 weeks, you better check to the hospital because you might be anemic. But deal with your fibroid, okay? In your situation, just do something about it. If you have fibroid, let's know the size of your fibroid. Let's know the location and remove it. If your fibroid is not significantly affecting your fertility, I can understand that. But if your fibroid is big inside your womb and you have all this presentation, go and remove them. All right? Can children go through depression? What are the symptoms? Of course, any age can go through depression. The commonest thing I will tell you about depression is this. If things that used to make you happy are no longer making you happy, like if you notice you're just sad for nothing, if you notice you're so withdrawn from things you normally take pleasure from doing, if you notice you're easily irritable, you're always crying for no just cause, people talk to you, you flip the whole thing, you might be depressed. If you notice your sleep is too scattered, sometimes you oversleep, sometimes you don't sleep. If you notice you've lost your appetite, yes, definitely. But depression is not something you just stay back and say, oh, I'm depressed, or the kids can be depressed. Yes, the kids can be depressed. It's the duty of a pediatrician to diagnose depression in kids. depending on their background, okay? All right. Does uterine adhesion reduce someone's chance of conception? Yes. If you have adhesions, it means this smooth surface, you can see how smooth the inside of the womb is, right? Now the egg will be released from the ovaries, enter the tube, the sperm will come in, fertilization will occur, then they will come back to implant. Now, if you have adhesions in your womb or in the cervix, when the egg wants to implant, they will not see a normal space to implant. So adhesions are bands, scar tissues that distort the architecture of your womb, making it difficult for you to become pregnant. So the answer is yes. If you have a diagnosed adhesions, you have to go for surgical removal of those adhesions, okay? All right. If fertility is very isolating, especially when everyone around you is getting pregnant, is it okay not to feel happy for them? Now, here's the deal. We are humans, whether you like it or not. When things are happening to your friends and they are not happening to you, you will feel bad. There are so many of you right now, you're listening to me, your friends are all getting pregnant. Anytime you go to your social media, everybody's announcing good news. You don't have a good news. Are you going to feel bad? Yes, it's a natural feeling. But this is where you need to throw in your matured way of thinking. When good things happen to your friends, be happy for them. Try. When bad things happen to them, be happy for them. If they give you invitation, if you want to go, go. If you can't go, just put in a word or send in some gifts. But don't isolate yourself. Don't avoid your friends. Don't, flip the whole narratives to be like, oh, your world is crashing. No, it takes a lot of maturity to do this. But by default, the fact you feel bad or you feel jealousy or you feel abandoned by your friend. Sometimes your friends might have kids. They might not have time to even look after their kids. So they might not be checking on you like they used to check. And for a woman going through infertility, it's very easy to think that everybody has abandoned you. That's a fact. It's a human nature. But you need to understand that people can still care for you and love you, but they might love you differently. People cannot treat you exactly how you want to be treated because no one knows you exactly how you want to be treated. So you have to be matured enough to know when good things happen to people and go rejoice with them, or when bad things happen to them and you go, condole with them and do all that. When you do this, you are actually helping yourself to be in a better place, psychologically, emotionally, and spiritually, to get your own good news. But if you keep avoiding everybody, if you keep avoiding functions, if you isolate yourself, even there are some people that will even isolate themselves from their mothers, from their fathers, they're just on by themselves. When you find yourself in this isolated spot, it's a deadly place to be. You can easily go into suicidal mode. So be happy for people when they're happy. Be sad for them when they're sad, okay? I love that question, Admin. For a woman going through infertility, is he also depressed? And is also depressed? And the partner is part of what that triggers our symptom. What's the best option for her? You have to deal with your reality. Okay? Now, I know some men are very combative. I know some men don't really like being called out. They feel that the problem is coming from the woman. You know the kind of man you married, right? But there are times you need to speak out. That's a fact. If your partner is abusing you psychologically, if your partner is abusing you sexually, emotionally, you can be going through infertility and your partner can be depriving you of sex, or your partner can be making love to you against your will. That's deprivation. That's abuse. If you happen to find yourself in this situation, first of all, I will want you to have a dialogue. I will want you to communicate with this fellow. Then if he goes beyond his comprehension and change, then seek professional help. Unfortunately, we are living in a society where women are seen as the downtrodden. So most people will not believe your story. But you have to be empowered. You have to know your reality. You have to know your rights. Nobody has the right to bully you. So if your relationship is not working, you walk away. Very, very, very important. I know some people will always talk. There are so many women that might still be the next victim of domestic violence. It's not only when you hit someone, you kill the person. There are some women that are practically not around because they've been so battered that they've lost everything in life. They're just merely in the physical. So find what works for you and your partner, then seek help. Be very, very careful. Most men, I don't know, especially men from developing countries, they don't feel anything can happen to them. They're so defensive. They're so not in tune with the reality. So be mindful, okay? There are even some people that will get subscription, and when you want to talk to the man will begin to think the woman is exposing the family for a lot of reasons. But you need help. So don't be afraid to seek help. if you find yourself in this situation, okay? Pregnancy after infertility can be filled with fears. How can one ensure safe pregnancy after trauma of infertility? I love this question, and it's actually the question I used to wrap. So here's the deal. There are different factors that can lead to infertility. Now, if you had infertility or if you had miscarriages or stillbirth, it's suspected you will be fearful when you eventually become pregnant. So we've had some women that had recurrent miscarriages every 10 weeks, every 12 weeks. Their pregnancy will go the same route. Now, what I want you to do is to seek professional help from day one. If your first pregnancy ended in miscarriage, if you have extended infertility, so in my group, my definition of extended infertility is an infertility beyond 1 year. If you've been battling this infertility and you're doing your best, then suddenly you went for IVF and it succeeded. What you need, number one, is to find the best. So find the best high-risk pregnancy specialist. Register for your ANC immediately. Restructure your lifestyle. Do everything in your capacity to support yourself. Deal with your support system. Deal with your stress. It's okay to be fearful in life, but courage is the ability to be afraid of something, but you still go ahead and do it anyway. Because the fact you didn't succeed or the fact you had poor outcome in pregnancy doesn't mean that subsequent pregnancies will go that way. There are so many women that had 5 miscarriages and they ended up looking for contraceptives. So each pregnancy is unique. Treat each pregnancy very uniquely, but seek professional help. So the biggest asset any woman out there that had rainbow baby situation, previously had problem with infertility, and you're now pregnant and you're so worried, some women can freak out and they begin to elevate their stress hormone. They begin to put that particular pregnancy in danger. Seek professional help. You can be afraid, you can be fearful, but you still go. When you have professionals behind you, when you have a good support group, when you have a supportive partner, when you have a good doctor, you can go through this and you can have your baby. Okay? All right. I love your question. So thank you so much for coming. If you haven't subscribed to this channel, please remember before you leave, hit the subscription button. We normally show up Saturdays about this time, 12 p.m. Eastern Time, 5 p.m. Nigerian time, then Tuesdays, 6:30 p.m. Eastern Time, 11:30 p.m. Nigerian time. My name is Dr. Trudy, and please think about the 5 coping mechanisms. Think about your mental health status. If you notice you're recently disorganized, if you notice you're dependent on people a lot, if you notice your decision making is poor, if you are not focusing on the now, if you're not focusing on your work, if you're not talking to somebody, if you're not talking to yourself, if you're not restructuring your thoughts, do all this. One thing I know, this too shall pass. You'll be called a mother soon. Thank you for coming, and let's quickly get to our Facebook so we can get the other clinic knocked off. God bless you, and I'll see you on Tuesday. Bye-bye.